breastfeeding remains the best way to provide newborns with all the nutrients they need and can help prevent those babies from growing up to be overweight. Each year, from August 1st through the 7th, people in more than 120 countries join together to celebrate World Breastfeeding Week, a global celebration meant to encourage breastfeeding and improve the health of babies around the world. Dr. Benjamin, thanks so much for joining us.
Thank you.
Let's get right to the questions. Why should moms breastfeed their babies?
Breastfeeding provides so many different protections for the baby. For example, there are less infections. There's less chances of having ear infections, diarrhea, pneumonia. Babies who breastfeed have less asthma, and babies who breastfeed exclusively for the first 6 months are less likely to have or become obese.
Besides just providing food for a baby, what are some of the other health benefits of breastfeeding for babies and also for mothers?
In addition to the infection and protection with immunology, the baby also has a less chance of having sudden infant death syndrome. And benefits for the mother, mothers who breastfeed are less likely to have ovarian cancer or breast cancer.
Let's talk about the economic benefits of breastfeeding. Are there economic benefits?
There are. What we find is that women who breastfeed find that they save about $1,200 to $1,500 a year in formula alone. That's a direct economic benefit. The American Academy of Pediatrics did a study that showed that if 90% of U.S. households were to breastfeed exclusively for 6 months, we would save $13 billion per year in reduced health care cost. Significant economic benefits. Workplaces find that women who breastfeed have increased productivity, they have less time off from work, and they see their medical claims go down for women who breastfeed.
That's amazing. So what obstacles do mothers encounter when they attempt to breastfeed?
There are a number of obstacles and that's what we want to encourage people to. Everyone can help support women who breastfeed. They really need our support. At home, particularly with the mothers and the grandmothers and the fathers, to support the women who want to breastfeed. When we go into the workplace, there's more and more women who are working today than in the past, and so we need to provide a supportive work environment for women who want to breastfeed. For example, we're asking employers to provide a clean and safe, as well as private room, other than a bathroom, where women can pump, and also provide them some break time that they can adequately go and pump. Just giving them the support that they need to get through those first 6 to 8 months of breastfeeding.
Great. Now, you've touched on this a little bit, but let's get into it a little bit more. How can families, communities, employers, and healthcare professionals do their part to increase support for breastfeeding?
With families, it used to be the moms and the aunts would carry down the tradition. They were the ones who knew how to teach the new moms what to do. But because many of the moms and aunts and grandparents didn't breastfeed themselves, they really don't know how to teach them. So we encourage them to take classes, to work with lactation experts, to teach moms the little intricacies about how to breastfeed, how to keep your breast from being sore, how to increase the production of milk, just by drinking more water and things like that. And dads can be supportive, and we have programs to educate fathers on how to be supportive as well. In the community, we have lactation specialists that are there, organizations that are set up to help moms in the community. In the workplace, we are encouraging these workplaces to be more supportive, provide break times, provide places for moms to pump. And in the healthcare community, almost 99% of babies in this country are born in the hospital. So we want to have baby-friendly hospitals, what we call, there's a designation that hospitals can get called baby-friendly hospitals, which means that they are doing certain things to encourage breastfeeding, as well as using less formula, particularly in the first 24 hours of birth. So there are things that the health professionals can do as well.
Great. I really wish we had more time. This is so important, but we're out of time. Where can our viewers go for more information?
You can go to my website, surgeongeneral.gov, and our call to action report is there. You can also go to womenshealth.gov and find more information.
Great. Dr. Benjamin, thank you so much for your time. We really appreciate it.
Thank you.